Atelectasis. The collapsed lung. What is atelectasis? Atelectasis is the partial or complete collapse of one or more lobes of the lung. It is caused by deflating of alveoli, small air sacs of lungs. It occurs when air cannot enter the alveoli, or if external pressure causes them to collapse. What causes atelectasis? Atelectasis pathogenesis involves the collapse of lung alveoli, due to following four primary mechanisms. Airway obstruction. Resorption atelectasis. External compression. Compression atelectasis. Surfactant dysfunction. Adhesive atelectasis. Lungs fibrosis. Contraction atelectasis. Let's discuss them one by one. Resorption atelectasis. Resorption, obstructive, atelectasis occurs when an airway becomes completely blocked, preventing air from reaching distal alveoli. The trapped air in these alveoli is subsequently absorbed into the bloodstream, causing the affected lung tissue to collapse. This often leads to a shift of the mediastinum toward the affected side. Compression atelectasis. Passive atelectasis, also known as relaxation or compression atelectasis, occurs when the normal negative intrapleural pressure is reduced or lost, causing the lung to collapse. The lung is naturally inclined to collapse, but is kept expanded by the negative pressure within the pleural space. When this negative pressure is lost or reduced, like when the pleural space is occupied by air as in pneumothorax, or fluid as in pleural effusion or blood, creating an external force, the lung relaxes or shrinks, resulting in decreased alveolar volume. The pressure exerted by the fluid or air in the pleura compresses the underlying lung, driving air out of the alveoli. Adhesive atelectasis. Adhesive atelectasis is a form of lung collapse caused by a deficiency of pulmonary surfactant rather than an obstruction. Lack of surfactant leads to high surface tension, making the alveolar walls sticky or adhesive, causing them to collapse and seal together. Unlike resorption atelectasis, the airways remain open, patent in adhesive atelectasis, but the gas-exchanging surfaces are compromised. The last type is contraction atelectasis. Contraction atelectasis, also known as cicatrization atelectasis, is a type of lung collapse that occurs when localized or generalized fibrosis, scarring of the lung parenchyma or pleura, prevents the lungs from expanding properly. Unlike other forms of atelectasis, it is generally irreversible. The scar tissue is stiff and inelastic, preventing the alveoli from expanding during inspiration.